So normally, I mean, when you go to the hospital, so if you have any disease, not so sure, the doctor may ask for the lab test. So the lab test can test on the biochemical, to analyze for biochemical pathology. Basically means that your liver okay or not. Okay, based on the biochemistry, your kidney okay or not. Okay, so check for biochemical, lipid, glucose, kidney test, lung function, so not lung function, I mean the liver function test. Those are biochemistry, or biochemical pathology. Hematology basically means that the bloods, we check how much red blood cell you have, hemoglobin enough or not. We check for the white blood cell, leukocytes, okay? Microbiological study basically means that we study any kind of microbes that are available inside your body, your tissue sample. So generally, blood sample are taken from patient, sent for the analysis in the laboratory. They use an automated cell counter. So result usually include a number of the red and white blood cells and also the platelets. So this table do not need to memorize. Basically, you tell you the red blood cell, white blood cell, and platelets, how much is a typical value per millimeter cubed, right? Cubic millimeters of the blood, and also in terms of neutrophil, B lymphocyte, T lymphocyte, and other kind of white blood cells, what are their percentage? Okay, so this one just for information only. So why we need to do the white blood cell count? So white blood cell count can be used to monitor a sample purpose. For example, a series of white blood cell count that continue to rise or fall to the abnormal level indicates that the condition of disease is getting worse. Are you clear? Okay, so white blood cell count that return to normal indicate improvements or successful treatment. So we can use as an indicator, okay, for treatment. Let's say, for example, certain disease may cause, okay, white blood cell count very high. After treatment, you can see that white blood cell count go back to normal. Then we know that's successful. Are you clear? Okay, now you can try on this white blood cell count. I will give you the answer later. Perhaps you can spend 2 to 3 minutes. Get whether white blood cell count increase or decrease. Have a guess. I will show you guys the answer later. Okay, not all. So now, generally, any disease that hits our bone marrow, basically hematopoietic stem cell lower. Are you clear? When the hematopoietic stem cell lower, means that the white blood cell count also low. This is common sense. Are you clear? So now look at this. Now, infections most commonly caused by bacteria or viruses. Okay, less commonly by fungi or parasite. This kind of infections will increase the white blood cell count because bacterial, generally neutrophil count will be high, viruses, lymphocyte count will be high. So this one we need to know. If you have any bone marrow damage, for example, toxin, chemotherapy, radiation therapy, or any drug that we take, damage the bone marrow, definitely decrease the white blood cell count because the hematopoietic stem cell number become lower. So this one we need to know. Okay. Now, in general, anything damage or disorder to the bone marrow is very simple. So if you do not know, okay, for example, they say that vitamin B12 folate deficiency cause the bone marrow disorder, decrease white blood cell count. Are you clear? Okay. Now, autoimmune disorder that attack and destroy our own white blood cell, this one, common sense, decrease. Okay, the white blood cell count. Inflammation or inflammatory conditions, for example, rheumatoid arthritis. So that's a question sometimes asked for inflammation. So inflammation we have learned, right? Okay, actually we attract more white blood cells. So therefore, inflammation definitely increase the white blood cell count. Okay, leukemia, myeloproliferative neoplasm. So in this case, leukemia increases the white blood cells, but highlight here. This one you need to know. Okay, it's a cancer. Leukemia is a type of cancer, definitely increase the white blood cells, but this white blood cell have no function. Are you clear? It doesn't mean that, oh, I have more white blood cells, my immune system better, but they have no function. As I say, that they are not developed cells. Are you clear? Okay, they lost the function. Okay, condition that result in tissue deaths like trauma, burn, surgery, or heart attack increases the white blood cells. Okay, because the necrosis in release a chemical attracts the white blood cells. Lymphoma, any kind of cancer that spread to the bone marrow. So when it spread the bone marrow, we know that bone marrow damage, correct or not? As long as bone marrow damage, decrease, okay? Dietary deficiency, not enough nutrients, decrease the white blood cell count. Disease of immune system, HIV attack our immune system, so therefore decrease in the white blood cell count. This one we need to know. And allergics definitely increase. Okay, so the one that I take now, the 4 that we need to know. Number 2 is general, as long as any disease that cause the bone marrow to be destroyed, definitely decrease the white blood cell count. Why? Because bone marrow contains this hematopoietic stem cells. So with insufficient hematopoietic stem cells, bye-bye. You won't have sufficient. That's why sometimes when you have this problem, we have the bone marrow transplants, so that we can actually produce, right, a new batch of this. Why bone marrow? Because bone marrow, we transplant the hematopoietic stem cells here. Okay, so let's look at some in more detail. During infections, definitely guys, infections, neutrophil increase when bacterial infection. Lymphocytes, particularly viral infection. HIV infections. Now, HIV actually destroy helper T cells right now. HIV destroy helper T cells. So therefore, CD4 count will drop below 200 cells per mm³. Okay, due to HIV disease. A normal range about 500 to 1,500 cells, but AIDS only 200. So how we know whether we successfully treat, or how to maintain the patients here? We can always look for CD4 cells count, not CD8. Are you clear? Okay. Leukemia. So in this case, we have 2 groups of bone marrow stem cell. As I said, that we have the myeloid stem cells and lymphoid stem cell. Okay. So myeloid will give us the neutrophil, monocyte, and platelets. Lymphoid give us the lymphocyte. So it depends on which kind of them develop into the cancer. So the cancer of the bone marrow stem cell is known as leukemia. Okay. So we have acute leukemia and chronic leukemia. Acute means they develop very quickly. Sometimes you have no symptom, nothing, suddenly, you are diagnosed with leukemia. Okay. So this kind of leukemia very fast. So we call it acute leukemia. Chronic leukemia may take many years to develop. Okay, so why leukemia? Immature cells increase, highlight, guys. Overall, you can see that white blood cell count increase. Okay, but they are immature. Even though increase doesn't mean that the immune system is functional. Are you clear? It may not function well, and because of keep on using this hematopoietic stem cell, it disrupts the normal balance of the component of the blood. Therefore, we don't have sufficient red blood cell and platelets. So most of the patients with the leukemia, they have anemia. Why? Because they don't have sufficient hematopoietic stem cell to make red blood cell. Okay, and also they can't make this platelets, so that's why they may have excessive bleeding. So one of the common features for leukemia, nosebleed. Continuously nosebleed, right? Why? Because we don't have, and the patients, they don't have sufficient platelets. Because all these hematopoietic stem cells have been used to make the non-functional, immature, lymphocyte, for example. Okay? And the number of mature neutrophils and lymphocyte decreases. Why? Because everything becomes immature. So it means that they become immunosuppressed. In this case, they are very susceptible to the infections. It doesn't mean that you become, like superpower now. You have more white blood cells. No, in this case, your white blood cells are not functioning. Okay? So become immunosuppressed. Okay, So let me stop the recording. So that's all for the white blood cell count. Okay,